The Serum Institute of India is in the eye of a storm over pricing of the Covishield vaccine for states, for the centre and for the private sector. The Serum Institute has defended itself, saying it has to invest in scaling up and expanding capacity to produce more vaccines. The opposition has slammed the centre's new vaccine policy, calling it discriminatory.
An ugly controversy right in the middle of a pandemic. After questions were raised by the opposition and many others on the costing of the vaccine, Covishield maker Serum Institute of India has defended pricing the vaccine at 1.5 times the initial rate. But is this justification cutting any eyes with those who say that Serum is having a free run? The company has now said the earlier pricing was based on advance funding, and now it has to invest in scaling up and expanding capacity to produce more shots. Serum Institute of India is manufacturing AstraZeneca's vaccine Covishield, and earlier this week announced a price of 600 rupees per dose and 400 rupees for state governments in any new contract by the central government. This compared to 150 rupees per dose it charges the central government for the existing supplies. This move invited criticism from many quarters. Actor Farhan Akhtar, among others, questioned why the price parity for centre and states. He then questioned what justified profiteering, asking why should the vaccine be so expensive, the most expensive in the world. This has also become a bone of contention between the centre and the opposition. Senior Congress leader Jairam Ramesh and the Ministry of Health in a back and forth on Twitter, with Ramesh questioning the differential rates and also asking why the prices of Covishield is the highest in the world. The ministry said, and I quote, "It is clarified that the Government of India's procurement price for both COVID-19 vaccines remain at 150 rupees per dose," unquote. The government also said that procured doses will continue to be provided totally free to states. The civil society also disapproving of the free hand given to Serum Institute.
What we have here is essentially a company that is taking full advantage of a public health emergency to profit, and the excuse that has been given that it needs to plow back profits into expanding manufacturing capacity.
The Serum Institute, in its defense, has said that they have to now ensure sustainability. There is great amount of uncertainty as far as the pandemic is concerned, and that they require this money to ensure that there is enough funds if there is capacity building that's required, if there is innovation which is required. They've also gone on to say that the price of the vaccine is actually much lower than the cost of many other essentials and medicines that are now being used to treat patients of COVID-19. In New Delhi, Sneha Mordani for India Today.
Hospitals in the national capital continue to grapple with the oxygen crisis. The Delhi High Court has issued a stern warning both to the centre and to the Delhi government to sort out the oxygen shortage. The High Court has said it will not spare errant officials who block the supply of oxygen. Delhi High Court has also instructed the centre to ensure 480 metric tons of oxygen is delivered to Delhi and asked the centre to give a date when the same would be ensured. Delhi High Court's warning comes after 25 patients died due to oxygen shortage at Delhi's Jaipur Golden Hospital. Though Jaipur Golden Hospital has now received oxygen supply, authorities claim 1,500 litres of oxygen is not enough. The prestigious All India Institute of Medical Sciences has also raised an alarm, saying it will not be in a position to take new patients due to shortage of oxygen supply and unavailability of beds. That issue has also since been sorted.
We are at the All India Institute of Medical Sciences in the national capital, and there is an acute shortage of oxygen being felt in the national capital, which is a reality, but it's getting worse by the day. And the situation is such that even an institute like All India Institute of Medical Sciences had to restrict admissions in the emergency services because there was an overload of patients and the oxygen pipelines had to be reorganized. We have got a statement from the AIIMS, And they have to say that the admissions in the emergency were restricted for an hour as the oxygen pipelines were being reorganized due to an increased requirement of oxygen for COVID-19 patients. Currently, AIIMS has 100 coronavirus infected patients who are receiving treatment. This is in addition to more than 800 patients who are already admitted at various centers of AIIMS. So right now the admissions are open and emergency department is very much functional. So you can get an idea of the intensity of the situation in the national capital, that even an institute, a hospital like All India Institute of Medical Sciences are feeling an overload of patients, and due to the acute shortage of oxygen, they had to stop taking patients for an hour in the emergency services because the pipelines had to be restored. So this is the situation where all the hospitals are extremely overwhelmed. They are overburdened up to the brim, and there is an acute shortage of oxygen which each and every hospital in Delhi is feeling. With camera person Sachin in the national capital, I'm Tanushree Pandey for India Today.
As the COVID situation worsens, the government has roped in the Army, the Navy, the Air Force, the Defence Research and Development Organization to join the war against coronavirus. The Indian Air Force flew the C-17 Globemaster heavy lift transport aircraft to Singapore to bring in high-capacity oxygen tankers. There are aircraft on standby to bring the same from the United Arab Emirates. Let's take a look at all the efforts the armed forces are making to help fight coronavirus.
Indian Air Force C-17 Globemaster heavy lift transport aircraft bring in 4 cryogenic tankers for movement of oxygen from Singapore. Aircraft are also on standby to bring in additional tankers from the UAE. The Indian Air Force and the Army are working closely on the acquisition of 23 oxygen generation plants to be procured from Germany and to be deployed in multiple military stations over the next several weeks as the armed forces prepare to deal with the surge in the COVID crisis.
When we look at other countries, we know that other major countries have had issues with the second wave, third wave, and even fourth wave. So I see no reason why we're going to be different and we will not face third or fourth waves. So this is not the end of it. And therefore, we are preparing for the long haul and making arrangements that we are well prepared for any further waves.
The Army has set up a 500-bed COVID facility for civilians in the national capital. Similar facilities with 900 beds have been set up in Gujarat in collaboration with DRDO and the Gujarat University.
ગાંધીનગરના હેલીપેડ પર પણ 1200 બેડની જેમાં 600 બેડ આઈસીયુ બેડ હશે એવી વ્યવસ્થા ડીઆરડીઓ તરફથી અને ટાટા સન્સ તરફથી બેના સહયોગથી ઊભી થવાની છે વખતે.
Defence Minister Rajnath Singh has also instructed the forces to set up COVID facilities in Lucknow and Prayagraj in Uttar Pradesh and in Patna, Bihar. The Army is simultaneously preparing to set up field hospitals and additional facilities in smaller stations and cantonments. The Ministry of Defence has sanctioned emergency powers to the Armed Forces Medical Services to acquire all equipment that is required to battle the surge. To cut the bureaucratic red tape, emergency financial powers of the Armed Forces personnel for acquisition have been enhanced. The Armed Forces have vaccinated all their personnel with the first shot and a majority have been vaccinated for the second shot. But with the uncertain pandemic, the Army is preparing for the long haul. With Abhishek Bhalla and Gaurav Sawant in Delhi, Bureau Report, India Today.
The situation in the armed forces much better with negligible cases of COVID positive. But as far as veterans are concerned, the armed forces are ensuring that they are not turned away. Capacity is being built up. I spoke to Surgeon Vice Admiral Rajat Datta, the Director General of Armed Forces Medical Services, of how the armed forces are playing a very crucial role in this war against coronavirus and their wargaming for the situation ahead. The armed forces, Admiral, have for decades, they have the experience of setting up field hospitals. Where all are you setting up these hospitals and what are the facilities, sir?
Thank you, Gaurav, first of all, for inviting me. We are at the moment putting up hospitals in various locations across the country. First of all, we have put up in Delhi, the DRDO hospital near the T1 area. more hospitals are coming up in Ahmedabad, Lucknow, Varanasi, Prayagraj, Patna, in that way.
And all these hospitals, will they be like the one in Delhi with ICU beds and oxygen supply everywhere?
Yes, so far it appears like that only. All state-of-art facilities, ICU beds, ventilators, monitors, everything.
Sir, last year, 1,000-bed hospital had been set up in the national capital, but if I remember correctly, less than 400 were occupied. How is the situation so different this year? Like the day you set up this 250-bed hospital near the airport, within a couple of hours, there were huge queues and every bed was occupied.
You're absolutely right, Gaurav. Last year, when we started this hospital, in the first month, overall in 30 days, we admitted about 50 to 70 patients only. And this time, as you said, in the first 2 hours of its opening, the hospital got swamped with 250 critically ill patients. So we are well aware that this time around, the wave is very strong. It's like a tsunami. The virus has become very infectious. It is moving around rapidly from one individual to another. Positivity rates are very high, and that's why we're seeing such huge numbers.
How bad has corona hit our armed forces, sir, in the second wave?
Fortunately, armed forces have been doing very well so far, and I hope that it continues to remain this way. Our numbers are much, much less compared to the national numbers, even when they're adjusted for the locations. Our numbers have been largely in around low 2-digit numbers, high 2-digit numbers, or very low 3-digit numbers.
Okay, and what's the reason for this? Because when you see Delhi, when you see Mumbai or other parts of the country where cases have just surged and you see the hospital facilities are overwhelmed, how is army or the armed forces, how have they been able to save themselves from this tsunami?
I think there are two basic reasons. The first reason being that we are a disciplined force, and the appropriate behavior for COVID, that is social distancing, hand washing, masking, is followed diligently across the entire armed forces. The second reason being that we have carried out our vaccination program with great alacrity. At the moment, nearly entire armed forces personnel are immunized with both the shots.
Okay, and in your appreciation, because they've all been vaccinated, it helps, and how?
Vaccination definitely helps. And as I said, today we have administered close to 27 million doses of Covishield. And what we call it as vaccine breakthrough, that means those who have received full doses of vaccine, and say about 2 weeks after that, those who have developed any kind of COVID-like symptoms, then total number at the moment is around 700. Mild, most of them are mild, a few of them are moderate, which means that the vaccine is extremely efficient in making sure that the individual doesn't land up in hospital, doesn't land up in ICU. Nearly 99% effectiveness we are seeing on ground.
Across India, healthcare infrastructure appears to have crumbled as cases have spiked, and the health infrastructure appears in stress, leading to patients being treated on the road outside hospitals. In some cases, patients are actually taking out their frustration. They're targeting hospital workers out of sheer desperation, and this must be avoided.
India's healthcare crisis is worsening by the day. Patients are lying outside hospitals waiting to be treated. Relatives are pleading for oxygen and medicines. Situation is grim across the country. In Ahmedabad, more than 30 ambulances have lined up outside the civil hospital for the third consecutive day.
3 घंटे हो गए।
अब तक कितना नंबर आप कहाँ पे थे और कहाँ तक?
30वां नंबर था।
30वां नंबर था और अभी
11वां नंबर है।
The hospital in charge says they have no other option but to take in patients when beds are available.
इतने सारे तादाद में दर्दी आ जाएंगे तो इतना डिस्चार्ज रेट नहीं होगा। इस हिसाब से हमारा नीचे ट्रायज भी फुल है, जितने भी हमारे हॉस्पिटल्स है मेडिसिटी में वो सारे बेड फुल है। हम चाहते हैं कि एक भी दर्दी लाइन में न रहे, लेकिन अभी परिस्थिति ऐसी है कि सारे बेड फुल है।
In some parts of India, the desperate situation is leading to a civil unrest. In Lucknow, hospital workers were beaten by the relatives of a patient who died. In Jhansi, district magistrate had to threaten hospitals after 16 private hospitals had stopped treatment of COVID patients.
एपिडेमिक एक्ट के हिसाब से जो सुचारू रूप से कार्रवाई करना है और डिजास्टर मैनेजमेंट एक्ट के तहत हम लोग जो कार्रवाई करना है वो हम सुनिश्चित करेंगे.
With India recording over 3 lakh cases for the third consecutive day, the battle against COVID is becoming grim. With Gopi Maniyar in Ahmedabad and Amit Srivastava in Jhansi, Bureau Report, India Today.
As the number of coronavirus cases continue to spike in the country, there are people who are doing a lot of good, and they are a ray of hope in this very grim situation otherwise.
As the virus continues to rampage across the nation, good Samaritans are not losing hope and continue with the good work. A Gurudwara in Ghaziabad has launched Oxygen Langar. Amid the rise in number of cases in the area, free oxygen is being provided by Gurudwara.
हम गाड़ी में ही आपको ऑक्सीजन प्रोवाइड कराएंगे, हम सिलेंडर नहीं देंगे, कुछ नहीं देंगे. आपका पेशेंट गाड़ी में आएगा, हम उसको यहाँ पे 2 घंटे, 4 घंटे, 5 घंटे, जब तक उसको कोई हॉस्पिटल का अप्रूवल नहीं मिल जाता, जब तक उसका अगला स्टेप नहीं चालू होता, कहीं हॉस्पिटल की बातचीत नहीं होती, तब तक हम ऑक्सीजन की यहाँ पे उनको सर्विसेज देंगे.
Meet Dikshita Vaghani, another dedicated COVID warrior from Surat who serves as an emergency medical technician in a government's ambulance. Along with discharging her critical duties, Dikshita is also taking care of her 7-month-old son.
मुझे गर्व है, मैं 108 में EMT की पोस्ट में काम कर रही हूँ. मेरे को सेवा का एक दूसरी बार मुझे मौका मिला है, इसमें मुझे गर्व है. और पहले भी मैं इसमें ही काम करती थी, लेकिन प्रेगनेंसी के दौरान मैं लीव पे थी और फिर दूसरी बार एम्बुलेंस में आई मैं.
Another COVID hero, Ravi Agarwal's service to mankind has gone viral on social media. Ravi is an auto driver in Ranchi and a college student. This has not stopped him from delivering food, medicines and other essential to the patients in home isolation without any charges. He also ferries patients to hospital whenever there is an unavailability of ambulances.
अब स्थिति ऐसा हो गया है कि लोग डर से केवल पैसा कमाने के लिए सब ऑटो निकलते, पर डर से लोग केवल डर से नहीं जा पा रहा था. तो उसी दिन हम सोशल मीडिया पे नंबर जारी कर दिए कि आज से जो भी आपातकालीन परिस्थिति में हम लिखे कि ऐसा नहीं कोविड हो, बहुत सारा ऐसा बीमारी है जिससे लोग डर के मारे कोविड के डर से नहीं जाते, तो जो भी बीमारी हो हम हॉस्पिटल तक निःशुल्क पहुंचा दें.
As the country is facing a shortage of plasma, a social organization in Karnal has stepped forward. The organization has made various WhatsApp groups to connect the donors with recipients. This effort has been able to save many lives across Delhi NCR.
मेरे को मार्च में पॉजिटिव हुआ था, तो मैंने इनको डिटेल भेजी है. तो ये इनके पास लगातार दिल्ली वगैरह से, दिल्ली और गुड़गांव साइड से बहुत ज़्यादा कॉल्स आ रही है प्लाज्मा के लिए. आज प्लाज्मा डोनेशन के लिए आया हूँ और यहीं पे भाई की कॉल आई थी, तो कि यही है कि हमारी वजह से किसी की कोई जान बच सके, तो हम उस सेवा में हर टाइम तैयार रहते हैं.
With the second wave of COVID-19 sweeping the nation, these acts of kindness are the ray of hope for many. Bureau Report, India Today.
Several hilly areas of Uttarakhand and Himachal Pradesh are experiencing unduly heavy snowfall at this point of time. I want to leave you with these images.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.